Good morning, and welcome to New Employee Orientation. My name is Sarah O'Connor, and I am an occupational health specialist here at the University of Arkansas for Medical Sciences. I realize orientation presentations can be tough to sit through. However, each person in this room is at risk of occupational exposure to blood-borne pathogens. So, it would be in everyone's best interest to pay close attention for the next few minutes. At the completion of my presentation, you all should be familiar with the following: what blood-borne pathogens are, who is at risk of exposure, how blood-borne pathogens can be transmitted, appropriate personal protective equipment necessary to prevent or reduce exposure, and finally, what actions to take if an exposure incident occurs. The Occupational Safety and Health Administration, better known as OSHA, prescribes safeguards to protect workers against the health hazards from exposure to blood and other potentially infectious materials by way of their blood-borne pathogen standard. This standard places requirements on employers whose workers can be reasonably anticipated to come in contact with blood or other potentially infectious materials. The requirements address items such as exposure control plans, the implementation of universal precautions, the availability of personal protective equipment, and employers providing hepatitis B vaccinations to employees. Blood-borne pathogens are defined by OSHA as infectious microorganisms present in human blood or body fluids that can cause disease in humans. These microorganisms include viruses such as hepatitis and flu, bacteria such as tuberculosis and gonorrhea, parasites such as malaria, and certain fungi. The three primary occupational blood-borne pathogens of concern include hepatitis B virus, or HBV, hepatitis C virus, or HCV, and human immunodeficiency virus, or HIV. At this point, you may be wondering, am I really at risk of exposure? There are approximately 36 million healthcare workers worldwide. Healthcare workers can include, but are not limited to, physicians, nurses, dental personnel, laboratory technicians, students and trainees, and even persons not directly involved with patient care, such as housekeeping, dietary, security, and volunteers. Around 3 million healthcare workers per year receive an injury with an occupational instrument. This results in 2 million exposures to the hepatitis B virus and 1 million exposures to the hepatitis C virus. Hepatitis B is a viral infection that attacks the liver and can cause both acute and chronic disease. It is spread by percutaneous or mucosal exposure to infected blood and body fluids. Hepatitis B virus can survive outside of the body for at least 1 week in dry blood on surfaces like tables or sharp instruments and tools. A vaccine against hepatitis B has been available since 1982. The vaccine is 95% effective in preventing infection and the development of chronic disease and liver cancer. OSHA requires that a hepatitis B vaccination series be made available to all employees who have a reasonable risk of occupational exposure within 10 working days of initial assignment. Hepatitis C is a blood-borne virus and it is most commonly transmitted through exposure to small quantities of infectious blood. It is the most common chronic blood-borne infection. The virus causes hepatitis C, a liver disease which can manifest as both acute or chronic disease. In other words, the disease can range in severity from a mild illness lasting a few weeks to a serious, lifelong illness. 60 to 80% of infected persons will develop chronic or long-term disease. There is currently no vaccine against hepatitis C. Human immunodeficiency virus is not exclusively blood-borne. In addition to blood, semen, breast milk, and other body fluids from a person infected with HIV can transmit HIV. These fluids must come in contact with a mucous membrane or damaged tissue for transmission to occur. Or in some cases, being stuck with an HIV-contaminated needle or other sharp instrument can also transmit infection. HIV targets the immune system and weakens the body's defense systems against other types of infections. HIV, if left untreated, can lead to acquired immunodeficiency syndrome, also known as AIDS. In 1987, the Centers for Disease Control and Prevention, or CDC, recommended the use of universal precautions, which became part of standard precautions in 1995 in order to prevent occupational exposures to HIV. Additionally, since 1996, occupational post-exposure prophylaxis with antiretroviral medications to prevent infection has been recommended. Universal or standard precautions are meant to reduce the risk of transmission of blood-borne pathogens. These precautions are the most basic level of infection control, which should be used in the care of all patients. Standard or universal precautions simply means that healthcare workers should assume and treat all blood and body fluids as infectious, regardless of known or unknown infection status. Key elements of standard precautions include proper hand hygiene, appropriate use of personal protective equipment, proper respiratory or cough etiquette, and environmental cleaning procedures, which include the controlled transfer or disposal of medical linens or medical waste. Transmission of pathogens in the work environment can occur by way of a needle stick or sharp instrument injury or direct contact of mucous membranes with infectious blood or body fluids. To prevent needle stick and injuries from other sharp instruments, never ever attempt to recap a needle, whether it's clean or contaminated. Always use caution when handling and disposing of needles, scalpels, and other sharp instruments or devices. Needle stick injuries do not occur exclusively in doctors and nurses. If a contaminated needle is disposed of improperly and ends up in a regular trash bag, the person whose job it is to retrieve and dispose of that bag is at risk of getting stuck by the contaminated needle. This should serve as a reminder to everyone to always dispose of sharp needles and instruments in the correct, properly labeled sharps containers and never place them in the trash. Additionally, broken skin, cuts, and rashes can serve as points of transmission if any infectious material comes into contact with them. And finally, exposure can occur if infectious blood or body fluids come into contact with mucous membranes, for example, eyes, nose, mouth, or broken skin. According to OSHA, Personal protective equipment, or PPE, is specialized clothing or equipment worn by employees for protection against infectious materials. Examples of PPE include, but are not limited to, gloves, gowns, face shields, eye protection or goggles, masks, respirators, and mouthpieces for CPR devices. Some key points about PPE. Gloves should always be worn when interacting with patients, touching blood or bodily fluids. Always remember to change gloves in between tasks or procedures, even if you are working with the same patient. Facial protection, such as a surgical mask, goggles, or face shield, and gowns, should be worn to protect mucous membranes of the eyes, nose, and mouth during procedures that are likely to generate splashes or sprays of blood, body fluids, secretions, and excretions. Always remove PPE and discard of it carefully so as to not spread contamination, and immediately wash your hands. The sequence of putting on PPE is also important. You should put on PPE in the following order: gown first, mask or respirator next, then goggles or face shield, and lastly, gloves. Obviously, if you don't need all of these, or if you have more, that would affect the order in which you put them on. These are the steps you should take if an exposure incident occurs in the work environment. If you have experienced a needle stick or sharps injury, or were exposed to the blood or body fluid of a patient during your work, immediately wash needle sticks and cuts with soap and water. Flush splashes to the nose, mouth, or skin with soap and water. Irrigate eyes with clean water, saline, or sterile irrigates. Report the incident to your supervisor and immediately seek medical treatment. Lastly, I will briefly pause while my information and image references are displayed. Thank you for your attention and welcome to Team UAMS. If anyone has any questions, I would be happy to answer them now.